One cycle of IVF can take about 2 to 3 weeks. The steps in a cycle go as follows. A. Treatment to make mature eggs. The start of an IVF cycle begins by using lab-made hormones to help the ovaries to make eggs, rather than the single egg that usually develops each month. Multiple eggs are needed because some eggs won't fertilize or develop correctly after they combine with sperm. Certain medicines may be used to stimulate the ovaries, help eggs mature, delay the ovulation, prepare the lining of the uterus. Most often you'll need 1 to 2 weeks of ovarian stimulation before your eggs are ready to be collected with the egg retrieval procedure. To figure out when the eggs are ready, you may need vaginal ultrasound and blood tests. Egg retrieval. This is a procedure to collect the eggs from one or both ovaries. It takes place in your doctor's office or clinic. The procedure is done 34 to 36 hours after the final shot of fertility medicine and before ovulation. Before egg retrieval, you'll be given medicine to help you relax and keep you from feeling pain. An ultrasound device is placed into the vagina to find the follicles. Those are the sacs in the ovaries that each contain an egg. Then a thin needle is inserted into an ultrasound guide to go through the vagina and into the follicles to collect the eggs. The process is called transvaginal ultrasound aspiration. If your ovaries can't be reached through the vagina this way, an ultrasound of the stomach area may be used to guide the needle through the stomach and into the ovaries. The eggs are removed from the follicles through a needle connected to a suction device. Multiple eggs can be removed in about 20 minutes. After the procedure, you may have cramping and feeling of fullness or pressure. Mature eggs are placed in a liquid that helps them develop. Eggs that appear healthy and mature will be mixed with sperm to attempt to create embryos, but not all eggs are able to be fertilized with success. Sperm retrieval. If you're using your partner's sperm, a sperm sample needs to be collected at your doctor's office or clinic the morning of egg retrieval. Most often, the semen sample is collected through masturbation. Fertilization. Conventional insemination. Healthy sperm and mature eggs are mixed and kept in a controlled environment called an incubator. In certain situations, other procedures may be recommended before embryos are placed in the uterus. These include assisted hatching, pre-implantation genetic testing. Embryo transfer. The procedure to place one or more embryos in the uterus is done at your doctor's office or clinic. It often takes place 2 to 6 days after eggs are collected. You may be given a mild sedative to help you relax. The procedure is often painless, but you might have mild cramping. A long, thin, flexible tube called a catheter is placed into the vagina through the cervix and into the uterus. A syringe that contains one or more embryos in a small amount of fluid is attached to the end of the catheter. Using the syringe, the embryo or embryos are placed into the uterus. If the procedure works, an embryo will attach to the lining of the uterus about 6 to 10 days after egg retrieval. After the procedure. After the embryo transfer, you can get back to your usual daily routine. Your ovaries may still be enlarged, so vigorous activities or sex might cause discomfort. Typical side effects include passing a small amount of clear or bloody fluid shortly after the procedure. This is due to the swabbing of the cervix before the embryo transfer. Breast tenderness due to high estrogen levels, mild bloating, mild cramping, constipation. Call your care team if you have moderate or severe pain. At least 12 days after egg retrieval, you get a blood test to find out whether you're pregnant.